Welcome everybody. We're coming to you live from the Bauman Cosmetic and Research Institute. I'm Milanit Samuels. This is my beautiful patient Lori and my amazing medical assistant Victoria. And we're here today to inject Volbella live. We're really excited that you can join us. So what's the hype? Why are we so excited about this? I think the best way to explain it is Allergan is the company that makes Botox, Juvederm, Kybella, and now it's the company that came out with Volbella. And when I like to think about Allergan sort of like being like Apple, that when a new product comes out, a new injectable, it's kind of like a new iPhone coming out, and we're super excited about it. We can't wait to see what it does. We can't wait to see what new thing it has to offer. And so that's kind of why we're all just so excited in the industry to see what this new Allergan product can do. Now, what is Volbella? Volbella is a new FDA-approved filler, and it's approved to increase lip fullness and to also decrease the appearance of fine lines around the mouth, otherwise known as perioral lines. Peri means around, oral means mouth. It's more commonly known as purse string lines or smoker's lines, and it's from constantly pursing your lips. You get these really deep lines that are very difficult to correct. So we're very excited to have this new product that's able to address that issue. What makes Volbella different from other injectables that we've used in the past for the lips? Volbella is a hyaluronic acid filler, just like Juvederm, Restylane, Belotero, but there are some little nuances about this product that makes it a little bit different. Hyaluronic acid is a natural occurring sugar in our body. It gives nutrients to the skin to make it nice and plump. But what's different about this product itself is it has a decreased molecular weight. It has the lowest cohesivity, and that means it spreads a lot when you inject it, as well as having the lowest affinity to water. So this would mean that we would expect to see a lot less swelling with this product, unlike other products that we have used in the lips that can cause significant amount of swelling. Lips in general are a very vascular area, very high incidence of bruising. So if we can do anything and use a product that can decrease our risks of swelling, that would be very exciting. Another thing about Volbella is that it kind of looks a little bit different to the injector, which is kind of cool. It has a pink plunger, unlike all other injectables that we're using. So when it's sitting on the tray, it's nice as a provider to let it stand out, and it's cute because it's pink and it's for the lips. So we just got a kick out of that. But without getting too scientific and getting too technical, the main difference between Volbella and the other fillers that we use is Volbella is really for the use of lips where you want a subtle effect. Patients like Lori who already have nice lips, but they just need a little bit of plumpness, just a little bit of subtle fullness. If a patient came in and really had thin paper lips, Volbella would not be my filler of choice. If I had to really build them lips and evert the lip, I would probably use something like Juvederm Ultra, or some people might prefer Restylane, and that's fine as well. So it's really going to depend on the patient and what we're trying to achieve. That's basically what Volbella is, and I think we're ready to start injecting. But before I ever inject a patient, I always like to ask them if they have any questions, any concerns. So we're going to turn the floor over to Lori to see if she has any questions for us.
Well, you did answer the most common question that I thought of, was the difference between Volbella and the other popular Juvederm. So you addressed that. But I do have a question. What if tomorrow I don't like it, and is it reversible?
Yes, so that's a very good question. So because it is a hyaluronic acid filler, there's something called hyaluronidase, which is an injectable that we're able to inject. So for any reason you don't like the way someone injected your lips, we can dissolve the product basically instantaneously by injecting this product. So never feel like you're stuck with it. As long as a hyaluronic acid filler was used, we're able to reverse whatever was done.
Okay. Is Volbella indicated for any other area of the face other than the lips as a filler?
Okay. So Volbella is FDA approved for the lips and again the perioral lines, the lines that go around the mouth. Although it is only FDA approved for these areas, it's up to the clinician and the patient whether or not they want to go off label. But today we're going to stay on label and just talk about the uses that were FDA approved.
And anything I should avoid immediately after having my lips injected?
Okay, very good question. So in our office, we give all our patients a post-injection sheet that lists a bunch of things that they should avoid to help decrease the risk of bruising. So things like not working out for 24 hours, staying away from non-steroidal anti-inflammatories for 24 hours, no alcohol, all these things. They won't do anything to the filler itself, but we do want to decrease your chances of swelling and bruising. So those are things that we would want to stay away from. Anything that gets your heart rate up, like lifting heavy weights, getting your heart rate up, we don't want that to happen.
Okay. I'm ready to go.
You ready to go?
Yes,
Any other question?
ready.
Okay. So one really great question I thought you were going to ask, but I'm gonna go ahead and ask it for you. How long is this going to last? Right? That's always the question I get. How long is this going to last? So on the FDA trial, Volbella was compared to Restylane. And about, I think it's somewhere between 60 to 75% of patients had satisfaction at 1 year. So this is very exciting to have a filler that looks like it would probably last closer to the 1 year mark rather than the 6 month to 9 month mark that we've been seeing with previous fillers that we're using. Again, this is a new filler that's just been on the market for a couple of weeks. So we can't really speak to experience. Other than that, I can say that I've spoken to a lot of physicians that have been using Volbella in Canada, which it's been around in Canada and in Europe for about 5 years. And they are very confident that this product is lasting longer and around the 1 year mark.
Okay.
Yeah, okay. Wonderful. So a little bit about the preparation of the patient. Before we started filming, Lori washed her entire area around her mouth with soap and water. This is very important because we want to get rid of any bacteria that could possibly be seated while we're injecting and decrease our risk of infection. But on top of that, we also cleaned her with a product called GCP. It stands for Good Clinical Practice. And this is used in a lot of surgical operating rooms to help kill bacteria. That product is actually made of silver. It's a silver foam. And silver actually is something that kills bacteria, which is very interesting. In other doctors' offices, they might use other antimicrobials such as chlorhexidine. But what's really important is that they're using something to help disinfect the area and to help fight against bacteria while we're injecting. I do want to stress that we're kind of wanting clinicians to use something more than just an alcohol wipe. Alcohol is really, we're kind of all in agreement that that's really just not enough at this point. You need to do something a little bit more to clean the skin. Okay. All right. Another thing that we did is we numbed Lori's lips. For about 15-20 minutes. I do recommend numbing the lips simply because, again, it's an area that's very sensitive. So we want the patients to be comfortable as much as possible. Some patients might choose not to numb, and that's fine. But also something to recognize is that within the actual syringe of Volbella, it's actually mixed with lidocaine. So the first stick is usually the stick that hurts the most. And after that, the lidocaine within Volbella and other hyaluronic acid fillers that contain lidocaine will then numb the area to make it a lot more comfortable for the patient. Okay. Now, I want to show you the box. This is what the box of Volbella looks like. And you can see that it has the little Allergan symbol on the corner, so you want to make sure that you're getting the real stuff. And when we're evaluating a patient, you have to look and make sure that your ratios and your proportions are correct. So again, Lori has really nice lips. She has a little bit of asymmetry. Right here you can see, it's very subtle, you might not be able to see it on camera, but it's something that she complains about, that this side is a little bit fuller than this side. So that's something that we're going to try to correct. But also, on a Caucasian woman, The proportions and the ratio that the lips should be is the upper lip should be 1 and the bottom should be 1.6. So again, we want the upper lip to be a little bit smaller than the lower lip. Now, something that we see on TV, housewives of whatever, and we're seeing this a lot, and it's a little bit frustrating to see, but a lot of people are injecting their upper lips way too much so that they're the same size as their lower lip or even bigger. And that's a very fake, unnatural look. That's not something that you should want to be going for. Again, you shouldn't be able to tell that you had anything done. The point of doing this is to just look a little bit more rested, look a little bit more youthful, not to be obvious that you've had filler put in. Agreed?
Right, agreed.
Agreed.
Thank you.
All right, so we're going to go ahead and start. So as you can see, Lori doesn't really have so much perioral lines. She has one little tiny scar up here, one really down there. So we're today, you know, in essence, for time constraints, we're really going to concentrate on the body of her lip more. Okay, so we're going to have you ice just one more time, and I'm going to lift her up just a little bit because I'm super tall. Okay, and I'm going to have you relax your mouth. Okay, little pinch. You all right? Mm-hmm. Okay. And I'm just putting little drips as I pull my needle out. And there's many different techniques to inject the lips, and you'll see many different ones if you look on YouTube. But this is sort of the way that we do it here at the Bauman Cosmetic and Research Institute. And just that little drip, you already see such a difference and improvement. I'm going to go ahead and ice again. And the reason I like to ice is twofold. One, for patient comfort. The other reason I like to ice is because I'm trying to cause some vasoconstriction. That means all those vessels that are here, I'm trying to make them tighten up and become small, so I'm less likely to hit them with my needle and decrease incidences of bruising. So another little pinch. How's that, Lori?
Perfect. I don't feel anything. Very comfortable.
All right, so I'm going to go ahead and take a look from back here. I think that looks really, really nice. I'm going to show Lori the mirror and make sure that she's in agreement that this is the size she would like. I would also like to have mention a little disclaimer. Again, these lips are very vascular. You can have little pinpoint bleeding. So if there's anybody out there that gets squeamish at the sight of blood or feels a little queasy, now might be a really good time to sign off of Facebook. But as you see, that's very minimal. But
yeah, I see a much more smooth finish here.
Right. So all the little tiny little I'd say wrinkles within that's what we're trying to get rid of. Exactly. Okay, great. So are you in agreement that this is a good size for your lip? Okay. So I'm going to go ahead and replicate that on the other side. Oh, I'm plugged in, so let's go this way. All right, so ice the patient. Okay. Ready, little pinch? Just smoothing it out just a little bit. Little pinch. Okay, now I'm going to come back here. Oh, that looks beautiful. Absolutely beautiful, Lori. All right, so now we're going to go ahead and we're going to address the lower lip. I'm going to come back to the other side. We're going to ice the area for Lori. How are you feeling?
Feel great. Feel great.
Okay. It's always very important to check in with your patient. Make sure they're still breathing.
Yeah, right.
Making sure they don't feel faint. All right. Nice. And open up just a little bit. I would like to mention that if anybody has any questions, you can go ahead and put that in the comment section of the broadcast, and I will do my best to answer them as soon as possible. That looks really nice. A little more over eyes. Close your mouth for me just a little bit and open just a little. There you go. Looks great. All right, let's go to the other side. Little pinch. You okay?
Uh-huh.
Good. How painful do you find this?
On a scale from 1 to 10?
1 being the least. 2.
Honestly. Mm-hmm.
That's great.
Yeah. It's just a little pinch. A tiny pinch.
Okay, just a little bit more ice right there. Lori is such a great patient.
I like to think I have a high tolerance for this stuff. I love it.
All right, let's take a look. That looks really nice, Lori. So I'm going to go ahead and hand you the mirror
Okay.
to make sure that you like this.
Mm-hmm.
What do you think? And do you see how your upper lip is now slightly smaller than your lower lip, giving you that really natural look? And you just have this really nice subtle fullness.
I love it.
You love it?
I love
Great.
it. Can't wait to put lipstick on.
Yes, that is a really good point. You really notice the difference when you're home in your mirror, in your vanity mirror, and you put your lipstick on. So we're so happy that you were able to join us for this live broadcast of Volbella. Again, if you have any questions, you can go ahead and you can write something in the comment section, or you can even give us a call here at the Bauman Cosmetic and Research Institute, 305-532-5552. And before you go, I am going to I do want to at least show you or talk about a little bit the perioral lines, even though we weren't able to do that for Lori today. She didn't really need it. But if you look on the Bauman Cosmetic and Research Institute website, you'll see that we have a before and after there of a patient that I injected the week Volbella came out. And I actually have the picture on my phone I can even pull up. Maybe you guys can see. So you can see with this patient, her lips were also a little asymmetrical. So we went ahead and we made them a little more even. And what's really significant is this patient had quite deep perioral lines, as you can see up here and down here. And look at that instantaneous result after injection with Volbella. So you're welcome to go look at this picture more on the Bauman Cosmetic and Research Institute. And we're so happy that you could join us. We're going to go ahead and finish cleaning up Lori. We usually put a little bit of arnica gel to help with the redness and inflammation, and that usually helps. And really just no downtime, as you can see. There really shouldn't be much more swelling than this. What you see is what you get with this product, unlike some other products that you wake up the next morning and your lips are super swollen. So we're gonna follow Lori closely and signing out. Thank you so much for joining us.